Hello everyone, I'm Dr. Berk. Why do we use antidepressant medications in patients with premature ejaculation? That's our question. Why did I want to address this topic? Because there is already a bias against antidepressant medications. Also, when we prescribe this for premature ejaculation but don't explain it well to the patient, the medications are generally not used. I'll briefly explain this. What is the mechanism? That's why previously it was a drug treatment for premature ejaculation. I had done something, I had made a video, it's getting a lot of views. Thank you. I recommend you watch this video. It was quite a nice video. Now, the medications used for premature ejaculation have effects on the brain. It is effective in both the brain and the peripheral system, meaning the end system. We differentiate between those that are effective in the penile area and those that are effective on the skin of the penis. I'll try this again later on. This work didn't just start all of a sudden. So this hasn't been the case for just the last 3 to 5 years. In 1994, Peter Kaplan found this out. They said that in 2 of his patients who were given antidepressants, there was delayed ejaculation. They said that the ejaculations were delayed. So 2 patients reported this, and after that, this is how this work started. Again, in 1994, Waldinger and his colleagues put a lot of effort into a medication related to paroxetine. In 1994, they conducted a serious study related to paroxetine. Our professors didn't sleep on this either. In 1996, they also conducted a study. By 1997, it was decided how many milligrams of this important medication, paroxetine, would be the most suitable to use. In 1997, a large multi-center study was conducted again. By 1999, the studies had increased so much that a compilation of these studies finally emerged. By 2009, there were already specific studies on the medications. Of course, from 94. 25 years passed until 2019. We've been using these medications for 25 years. It's not special to today. It hasn't just started yesterday. That's why these medications have been used safely for 25 years. I explained it like this in the timeline drawing. Well, just to convince you a bit more. Now, I mentioned a little earlier, it's about the effectiveness of the medications. The antidepressant medications we use here are related to serotonin. It's commonly known as the happiness hormone. It's not exactly like that, but that's how it's referred to. The medication we use to increase this happiness hormone is called SSRI. So it's referred to as a serotonin reuptake inhibitor, what we call serotonin. It's a neurotransmitter. I'll explain it shortly. It's released from tryptophan. Now, this looks very complicated. I'll explain this very simply. Think of this like an electrical transmission. Think of this nerve here, the main cable like electricity. Think of the middle part like a socket. Think of this as the cable going to the electronic device that will be powered. Transmission in the body is not that simple. When a stimulus comes, this nerve releases a series of substances. Substances are being released. The most famous of these is adrenaline, which you might know. These are released. After these are released, there is a gap on the other side. In between, it reaches the nerve cell on the other side by passing through there and creates a stimulus. And as a result, for example, adrenaline excites you. It's causing palpitations, etc., etc. Serotonin also has its own characteristics. Our medications work through serotonin. After serotonin is stored here, it is released when a stimulus comes. After being released, it goes to the nerve cell on the other side, and there it has its own receptors. By holding them, it does a number of things inside. For example, there is amphetamine here. As you know, amphetamine is a stimulant. There's nothing in the middle. So if you take amphetamine, all the serotonin in your nerve cells gets stored, and as a result, you experience hallucinations, happiness, and other pleasant feelings, or rather, situations that are incompatible with life, incompatible with reality arise. Our medications do not cause excessive release of serotonin. These are antidepressant medications. Only a portion of serotonin is reabsorbed and is destroyed here. These medications affect the reabsorption of serotonin. When it affects the reabsorption, serotonin increases in this area. And when it increases, it's not premature ejaculation. It's delayed ejaculation. Well, teacher, I will get through this. Well, just like that, look, a stimulus is coming here. Serotonin is being released. These drugs block the reuptake of serotonin, and the amount of serotonin here is increasing. So are these medications really effective? Yes, we've been using these for 25 years. Almost all of them are similar, in particular, but some are important. Paroxetine, group medications. It can increase delayed ejaculation by 8 times. So, if a person ejaculates in 20 seconds, when they start taking this medication at 20 milligrams a day, this situation can extend to 140 seconds. So, is it enough to use medication alone? I don't think it's enough. There's a really nice study here. Look, there is a slight increase in those who use medication alone. But with medication and behavioral therapy, the duration can really extend a lot for those who use behavioral therapy. I had also made a video about behavioral therapy related to premature ejaculation. This was a really nice video. Honestly, what should be done to avoid ejaculation? What should we pay attention to? It was a video explaining these because I had said this, premature ejaculation is a condition that can be controlled. It's a condition that can be learned, just like learning to drive a car. Anyone who wants can learn this, 100% with a little effort. So today, premature ejaculation, this is the best treatment. It is the use of antidepressant medications, that is, medications that enable serotonin reuptake, together with behavioral therapy. After that, they can be separated. Obviously, once a certain behavior is achieved, the drugs can be stopped. For some people, no matter how much behavioral therapy we do, we cannot stop taking the medications because they have a problem with serotonin, that is, with these. So we think there is a genetic problem here. So we continue to use these medications, but at least people are not ejaculating in 20 seconds. It increases by 7 to 8 times. In fact, when behavioral therapy is added, they can ejaculate when they want. Thank you.